So Dee and Carol and I are part of a group that have worked on these issues for almost 30 years now. And so I wanted to, with Dee, give you a background about how this all got started. This is back in the 70s. And about that time, there was neonatal intensive care units started in the late 60s, and the Children's Medical Services were founded in 1975. So the first step in Florida getting with it to care for mothers and babies was really building neonatal intensive care units in 11 regional hospitals around the state. Shortly after that, 3 or 4 years after that, they realized that they also needed services for high-risk mothers. Start law was established then. This really was Governor Mrs. Childs, our coalition group, Carol, Dee, myself, lots of people around the state having input, some really great women legislators who really got together with the governor and said, here's what we need to do. And so the Healthy Start Law in 1991 did these things. It increased Medicaid again from 150 to 185% of the federal poverty level. It increased payment for pregnancy providers. Up to that time, it was hard to get private doctors to see low-income people because they were only being paid $300 for total care, prenatal care, delivery, and postpartum. We raised that to $1,000 for midwives and doctors. We expanded the Children's Medical Services clinics because, for instance, in Tampa, if somebody in Fort Myers had high blood pressure, they'd have to drive all the way to Tampa to be seen at the CMS clinic. So we put clinics in Naples and Fort Myers as an example. We mandated prenatal and infant screening. That was supposed to be just for low-income people. But the way the legislature works in strange ways, by the time the bill was drafted, it was for all women in the state, which I thought was great. But the private doctors were appalled, and I used to joke with them that, you know, if they didn't do the screening, they'd be put in jail. But a lot of coalitions like this one have really worked with the docs and the midwives to try to get screening rates up to 100%.
So what's so different about coalitions? Well, none had to have decision-making power, and that's where the rubber meets the road. But there were also responsibilities, that the money had to be based on an assessment and a plan. But I want to step a little bit more beyond that. That's sort of the mechanics of what you do, but really what was implied, you were to build social capital. I have to congratulate. I read Carol's timeline you've developed here, highlighting all of your successes, which are in the document. It's really impressive. It wouldn't happen if you hadn't worked collectively together and really lived the vision, I think, that Lawton had for communities. He worked with a man who wrote a book called Reinventing Government. It's about turning things upside down. Well, that was David O'Brien? Osborne. David Osborne. Anyway, you've lived it. You've turned things upside down. You're reaching into the community. You're giving people the ability to speak for themselves. You do this through active listening. It isn't just that you've decided you can speak for people. You really do responsible listening. So together, I want to say happy birthday. The baby's been successfully born, nurtured and developed here in Northeast Florida. Healthy Start Coalitions are a force to be reckoned with.